Focal atrophy of neural rim, also known as notch. When you look at an optic nerve head, if you find, so it's first as a good starting point, you locate the optic nerve head and you say, where is the boundary of the optic nerve head? So you outline the boundary, which is the scleral lip, and say, all right, so that's the boundary of the scleral lip. You can see rim tissue present, rim tissue present, rim tissue present. But in a particular region, rim tissue is very limited or absent, and that's called focal atrophy of neural rim, or a notch. Usually, in glaucoma, we find that the inferior rim erodes first. So what happens is that if you're looking at an optic nerve head, you see the CD ratio, the vertical CD ratio tends to be larger than the horizontal CD ratio because the inferior rim tends to get eroded first. That doesn't mean that every glaucoma patient, the inferior rim should be the first to leave. It could be other parts as well. But on average, we usually find inferior rim erodes first. So in this case, you see that the inferior rim has eroded. You can see the boundary of the optic nerve head right about here, and there is not much rim tissue left. How do you know? You pay close attention to the picture, and what you find is that these small blood vessels are almost touching the edge of the optic nerve head. You look at small blood vessels and how they bend around structures, and you can identify the rim tissue. That's the most ideal way to identify rim tissue. In the absence of the most ideal way, or you find that there are not much capillaries, we use any cues in 3D. You can actually identify if there is a dip. That's usually very helpful when you identify that using a slit lamp BIO, and you look carefully. Color is the least desirable method of identifying where the optic nerve head cupping ends. Now, color can be quite misleading given the camera picture that has acquired it. But here we have a two-dimensional picture. That's all we have. We don't have the patient. And if we were forced to identify where the cupping was, what we do is look for these smaller blood vessel deflections, and we all use a little bit of color to our advantage to sort of see where the blood vessels in that pink region are bending. So if you look right here, that's the region of absence of rim tissue. That is the notch or focal atrophy of neural rim. I want to show you another picture. Look right here. You can see this. First, let's start with the boundary of the optic nerve head. Okay, so that's the boundary. The rim tissue is much more obvious in this case. So you can see all this is rim tissue, rim tissue, rim tissue. That could be, that's cupping right there. All that is cupped. If you look right here, so there's enough rim tissue here, but as you follow this region from 7 o'clock to 6 o'clock and 5 o'clock, you find that rim tissue is becoming lesser and lesser, and here it's a little bit more. So about 4 o'clock, it's more. At 5 o'clock to about 6 o'clock, there is a dip in rim tissue, and then 7 o'clock, you have significant rim tissue present. This region where the yellow arrow points out is also a notch or focal atrophy of neural rim. Now, a true notch is associated with some amount of nerve fiber layer loss present as well. Now, you may be able to identify it. You may find it difficult to be identified. In this case, it's very obvious. If you look right here, you can see all these striations present. You can see these white lines-like thing. Okay, so that shows there is actually nerve fiber layer. You keep following this and say, all right, there are striations present here as well. Okay, that's a dark patch right there. And you can see striations are present here, these white lines. So these are basically bundles of axons going towards the nerve. What you find is that now if you find a dark patch like this, and if you follow that dark defect or patch towards the nerve, you can identify where the notch is. So you can find a notch and then look for nerve fiber layer defect, or you might find a nerve fiber layer defect like this, and if you follow a nerve fiber layer defect, if it's a true nerve fiber layer defect, it really does produce a small it does produce a notch. Now, sometimes it may be really subtle and you may not be able to identify it, but a true nerve fiber layer defect should produce a notch.